you're doing cardio, you feel like you're just running on reserves that you don't really have. It's like borrowed energy. It's a very expensive way to exercise metabolically, I think, for many people. I do think some people are made to run, and that's great. And Ray McClanahan, and there's some other doctors out there that are avid runners, but even Ray will tell you he strength trains. He doesn't just run, so I think it's a balance. But I think for some people, just hitting the weights, starting there, it's a very, it's a kind way to treat your body. When you lift weights, you get afterburn. And afterburn, is, as you know, is where you metabolically rev up your system. And so for 3 to 4 to 8 hours, depending on how well trained you are or more, you get this metabolic benefit where you're burning fat. You are literally, you turned yourself into a little fat burning machine engine, and you're getting the hormonal benefits and all the other benefits happening for a pretty long period after. And so that's what I was after. I was looking for the most bang for my buck. I don't have a lot of time, so it's like, what can I do efficiently without exhausting my poor little adrenal glands?
Welcome back to High Intensity Health Radio. Really excited to be here with Dr. Tyna Moore. Tyna, you're a naturopathic physician and also a chiropractor, which is a unique combination of credentials, and you teach people about prolotherapy, and that's what you teach the practitioners and also a big part of your practice. But also recently you shared offline a personal story about how you really got into weightlifting, and it changed your life. It made you more resilient and strong in many different parameters. So I think that's a great place to kind of launch from and talk about the role of strength training and muscle and beyond just aesthetics and how it can improve our life. So let's start there.
Yes. I'm excited to be here. Thank you for having me. So I got into strength training a couple years ago because I was always a pretty fit person, and I went to do a lecture out at the chiropractic college, and my daughter stopped me and told me that I needed to change my dress. And so I asked her why, and she said because I had a flat butt. I had a lady butt. And I was horrified. I didn't really know what that meant, but I knew that it wasn't a good thing. She said, when it gets flat and saggy. So I immediately started looking into how to grow my glutes. That was my number one goal. And I met Brett Contreras through that, who's the glute guy. Very nice guy, very giving with information. And I started researching it, being kind of the geeky, I'm a doctor and I love to do research on anything that I'm doing because I want to justify and back up everything that I really believe in, especially if I start preaching it. So I really got into the science of it, and ironically, my whole practice is pain. Turns out having strong glutes takes care of most people's pain, even if it's shoulder pain. The glutes are kind of like the central hub of holding your spine together. So without glutes, you don't have a good core, and then you've got nothing, and your spine is basically disintegrating off of itself. So I got really into glute science, and from there I got into just muscle science, lean tissue mass, lean skeletal muscle mass. And I started strength training myself. Probably about 1.5 years into that, I was just kind of messing around at the gym. I didn't really know what I was doing. I had my husband helping me at the time, and he didn't really know what he was doing, and I kept hurting myself, so I thought, this isn't for me. And then I got serious. I hired a trainer. His name is Derek Gleason. He was brilliant. And I went in and I said, I don't want body composition analysis. I don't care how much fat I have. In fact, it took me a lot to put this fat on. I've always ran underweight, somewhat on purpose, I think, now looking back. And I said, I just want to learn how to deadlift perfectly, and I want to learn how to squat perfectly so I don't hurt myself, because I have some back injuries. So he did, and we worked on that for about 12 weeks before he finally gave me a good job. He finally gave me a thumbs up after 12 weeks. And the benefits were enormous. I couldn't believe what was happening. I normally run, like I said, very thin. I started noticing distribution in my weight, and so while I was really trying to keep fat on, I think having a healthy fat level is important. I think for our hormones, especially as women, being too lean is very detrimental to our hormones. So somewhere around 20 to 22% body fat is my goal to stay at, which was not my whole, I grew up in Southern California where as skinny as you could possibly get was the life goal, right? And much to the dismay of my overall health, I think most of my life. So anyway, started getting stronger, quickly realized that unless I ate enough food in the right quantities that I wasn't healing, and I wasn't getting any kind of muscle gains or strength gains, which was totally bumming me out, to be honest. And finally my trainer pulled me aside and he said, you're the naturopath, you know this better than anyone. You need to eat. I was getting so skinny. And of course that's a little addictive when you're used to that. And then I realized that I think I had a lifetime eating disorder, really. And it was really, I'm an undereater. and I really am. And it was very hard to overcome that. And I kind of forced myself, and I started seeing the muscular gains, and I started seeing the benefits, kept doing the research, and it's been, 3 or 4 years now? Somewhere around 40, back up a few years, somewhere around 40, I decided I was going to give up being completely OCD about my food. You're in the health community. You know how you can get that orthorexia pretty easy, which is where you basically you have an eating disorder because you're crazy about being healthy, you know, and I see that in this community a lot. And I had orthorexia for sure. And I started realizing I had more resilience. I was healthier. I could handle getting hit with some gluten or getting hit with some other foods that I normally couldn't handle. And I was thriving. That was the thing, I was thriving. And I'm not to be too transparent, but even my breast tissue started growing and my gyne doctor she's been my doctor for easily a decade. She did an exam on me and she said, this is the healthiest I've felt your breast tissue in 10 years.
Wow. And
I thought, what? And she's like, what are you doing? And I wasn't taking any hormones. I had in the past, I had needed some bioidentical hormone replacement, even at a young age. Wasn't on hormones anymore, was feeling really good, and I realized it was the strength training. So that was kind of the journey, was just deciding to eat and lift as much as I could with good form and do it frequently enough that I gave myself a chance to see gains. So 3 times a week was the minimum. Overtrained a few times, which you've probably done. Yeah. You get sick, you get run down, your adrenals crash, and you realize, okay, I can't train that hard. So found kind of what the sweet spot was for me, realized it was very time efficient. I'm a really busy lady and busy doctor. It was very time efficient. It brought me a lot of joy, did amazing things for my mental, emotional state. It was a place where I could meditate, you know, really. I mean, you kind of have to. Do you do CrossFit?
I don't. I do powerlifting-like movements, but I know I know what you're saying, because you have to be in the zone and really be present and mindful and aware of your body and stuff like that. And, you know, being on cardio, you can have sloppy form on the elliptical or a treadmill or running. I mean, so it's a different mental state. And so,
totally. And I don't really love CrossFit. I love that it gets people moving, but I think that those lifts are so technical that doing them at a high velocity for reps, for speed, it can be really dangerous. I make a lot of money off those people. I'll be honest. I see them in my practice. I have to do regenerative joint injections on them. But just really that slow, methodical, I'm going to do 5 sets of 5 heavy deadlifts or whatever it is. You know, that was really what kicked it off for me. And I don't know, because we don't have any studies showing the benefits on neurotransmitters, but I know my neurotransmitter levels and my GABA and my dopamine go through the roof for about 2 to 3 days following a good heavy. And it has to be heavy. I don't get that from any other exercise that I've ever done. Wow. I just come out super zenned out, and I see that with patients when I can finally get them lifting. They're like, oh, I'm calm, and I'm happy, and, you know, it's something that Xanax can't really bring, so.
Yeah, or self-medication with alcohol or something like that. But, So just to back up and kind of summarize, so weightlifting was really a transformation. Yeah. But it was hearing your daughter say that about you, like you probably knew that weightlifting was good for you in a sense, and maybe you dabbled a little bit, but what was it, like your first step, you just knew that if you squatted and deadlifted, your body would change after that comment from your daughter? Was that the first step? Well,
I went on and started reading Brett Contreras' stuff, and he was talking about glute activation. And I know my anatomy and I know my biomechanics very well from being a chiropractor. And I am treating these things all day long, and I couldn't figure out why I was seeing so much I see a lot of lumbopelvic pain in women in particular. And I started paying attention, and the one thing that every single one of these women had in common was completely atrophied glutes. And so that was even more compelling for me. My medical assistant who assists me with procedures is also a personal trainer. So she and I kind of got her geeked out on it. So she was doing her research. She's much younger, so she gets her gains much faster. She looks at a barbell and things start to grow, her muscles. But we just both started paying attention at people's gait and their glute, size. And when someone lays down on the table on their stomach, their sacrum should be in the middle and their glutes should come up like 2 mounds. In a lot of these patients, and cadavers too, which is sad, you lay the cadaver on its stomach and the sacrum is very prominent and the glutes kind of slope off like this, because most cadavers are elderly and have been bedridden, and so they've completely atrophied and then everything dried up after they passed. I was seeing this in live women, and some men too. And when you sit on your butt all day, you get
It's not
amnesia.
working.
Yeah, your butt gets amnesia.
Right, which is scary.
It is, and so I had all this chronic low back pain. For a decade or more, I'd had chronic low back pain, and it was slowly getting better and better and better.
Mm-hmm.
So that's what got me motivated to keep going.
Yeah.
So it started with glute bridges and body weight squats and just really simple. And then when I started to decide that I wanted to load the barbell, I got help.
Right, with
I
the
tried,
right form.
Yeah, I tried it a few times alone, and that didn't go well. So I probably looked like a chicken making,
Right.
I always tell everybody, go hire a good trainer.
Yeah, it's huge. Yeah,
it makes a big difference. And again, the overall gains just started coming out. And then the research that I did, I came across one article that showed the difference between testosterone and human growth hormone levels post-workout between a body weight squat with a barbell and a leg press machine.
Mm-hmm.
And it was something like 80-some% higher. And it was a small group. It was a small study. It wasn't a great study, but it was on men who did barbell free weight squats had a significantly higher surge of testosterone and human growth hormone levels following. And, I'm not getting any younger, so anything I can do to get my human growth hormone levels up is...
It's huge.
Right. And there's sprays and there's supplements and there's... Obviously, you have to get adequate sleep, but you actually can tweak them by how you exercise.
Mm-hmm.
Not just exercising, but how you exercise.
Right. And like you said, but using those full body weight movements, not just working out your legs, it's the squat specifically, yeah.
It's the compound.
Yeah.
You've got to put that neural load on the whole system.
Mm-hmm.
And that's when it's hormesis. It's the idea of, in my head, I think of it as hormesis. You stress an organism. Hormesis is where you stress an organism and it responds to that stress in favor. So like a plant, I always fail to water my plants adequately, but when I do, they explode, right? That's hormesis. So the same thing with the body. You put the body under adequate stress that's controlled, you rest it appropriately, and it grows. So
it's a great way to look at it, and it's awesome. But I want to talk about the benefits of weight training and all that, like brain-derived neurotrophic factor, but first talk about the mindset and the potential hurdles that I hear a lot, even from my wife, who has been a runner her entire life and has this cardio mindset, and it's really pervasive in our society. So a lot of women don't want to do like you mentioned, you got the most benefits by doing a high volume, low rep, right? Like 5 by 5, 5 sets of 5 rep, really lowering the bar. But I'm not looking at you and seeing like these, you look fit, but I'm not intimidated. You look, right? And so women have this perception that if they're going to get doing deadlifts, they're just going to blow up like a bodybuilder. And it's like, come on, that's not going to happen. So let's talk about the mindset of that.
Well, I always tell people cardio makes you better at cardio. And this is no diss on runners. I have a lot of them as patients and friends. I get it. But cardio only makes you better at cardio. So for that time period that you're doing the cardio, you are getting the advantageous benefits of cardiovascular improvement to some degree, although you can overdo that easily. But you are just getting the benefits, the health benefits during that time that you're doing the chronic sustained cardio, whether that's a spin class or running, or it doesn't matter. When you lift weights, you get afterburn. And afterburn, is, as you know, is where you metabolically rev up your system. And so for 3 to 4 to 8 hours, depending on how well trained you are or more, you get this metabolic benefit where you're burning fat. You are literally, you turned yourself into a little fat burning machine, engine, and you're getting the hormonal benefits and all the other benefits happening for a pretty long period after. And so that's what I was after. I was looking for the most bang for my buck. I don't have a lot of time, so it's like, what can I do efficiently without exhausting my poor little adrenal glands that are already ash piles upon my kidneys? That's the thing. I don't have a lot of adrenal or thyroid function anymore, just due to what the stress I put myself under and autoimmune disease. And so for me, it's really important that I come out of an exercise feeling refreshed and invigorated, not beat up and trashed. And whenever I ran, I just would kind of burn that system out, that hormonal system. And I see that with a lot of women. I see them metabolically burning themselves out. And it lasts, there's a benefit for a while when you're a runner, but after a while I start to see some pretty gnarly changes on labs. And not everybody can sustain that for long. Anyway.
Let's pause right there. Gnarly changes, like are we talking in the endocrine system or stress-related hormones? What do you see with runners?
They burn their adrenals out. They burn their whole once the adrenal system crashes, all the hormones start to crash out. And I see a lot of runners and cyclists with diabetes, skinny fat. They end up, it comes down to skinny fat, I think. You look thin and you can fit into a size 4 or 6 jeans, but metabolically you're showing up as skinny fat, which is basically the idea where you're kind of looking at this pre-diabetic picture, although you're very lean. It's not a heavier person's condition alone. We used to think it was, but you know, you end up as a lean person which is, in studies are showing, is way more dangerous. Those people die a lot faster.
Right. Yeah, it's interesting, and it's a lot greater. The prevalence of this normal weight, metabolically obese, is like 20% of the population, which is really interesting. So a lot of people, when I was doing a lot of nutrition consults and stuff, I was really surprised when I would look at someone's phenotype and then their lab work. I was like, whoa.
So you see it too,
yeah,
then.
It's really interesting, and it's that cardio. So I wanted to bring up something about this. We can like take a deep dive here.
Sure.
A study showed that type 2 diabetes starts with skeletal muscle, insulin-resistant skeletal muscle in the leg tissue. It was really interesting.
Wow.
And we think, like, where does insulin bind to? We hear about blood glucose going up and insulin surges, but we know that insulin latches on primarily at like 80% of it onto muscle tissue. So it's like, well, then get squatting, get deadlifting, build up that muscle.
That's the fastest way out of insulin resistance, is to build muscle. The first thing that happens is your body starts to burn up the fat in your liver. Patients come in here all the time and they're like, oh, I have fatty liver. Like, it's a casual thing now. And I'm looking at them thinking, if you knew what I knew, alarms would be going off in your head. Sure. I mean, you've got fatty infiltrate visible at this point. Like, that's not a good thing. It's not just elevated liver enzymes on labs at this point, you know, or disrupted lipids. So anyway, I realized I was skinny fat. Mm-hmm. That's pretty much what it came down to. I was doing a lot of Pilates and I was running, and I was doing what a lot of women do. I really wasn't terribly worried about bulking up because I kind of wanted some curves. Mm-hmm. I was kind of looking more for like that Linda Carter Wonder Woman, you know, thing. And I started going on Instagram and seeing all these fitness, and granted, I don't think that that's the best route. I mean, you can get some messed up mindset doing that, but realizing that these women who were strength training and watching them lift really heavy weights and then looking at them in a bikini, I was like, I've always been the kind of person that thought, I want to look like, I'm going to do whatever activity looks like that person. If you want a sprinter's body, go sprint. If you want a surfer's body, go surf. If you want, you know, a swimmer's body, go swim. And so I think the combo between the Pilates and I had this skinny, fat, flat butt from doing years of very high level Pilates and running. And so I was in good shape compared to most of America. I looked good in my clothes, but, you know, I was skinny fat, and metabolically on my labs I was as well. So started strength training heavy and started seeing my thyroid antibodies go down, started seeing my testosterone and estrogen levels come up. I started seeing my blood sugar regulate better, my insulin. My insulin was actually too low. I was one of those people that was so burned out that I had like an insulin of 2 no matter what I did. And that's bad, you know. So my insulin came back into that healthier range of like 3 to 5, you know, and it floats in there. And I wasn't bulking up. I was just redistributing my body weight. And I see this with patients all the time, and I see this with people I can motivate to start lifting. I see this really wonderful redistribution of body weight. I think it takes about 90 days to start noticing it. Same as labs. I don't know about you, but it takes about 90 days to start seeing metabolic changes on labs with dietary changes implemented. I think that if people would start strength training as well as making those dietary changes, we would see changes much faster. But I think it's the missing link. It's really underappreciated. It's really understudied. I don't know why. I don't know why people aren't taking this up. Maybe it's because anyone can put on a pair of running shoes and go out and run.
Mm-hmm. Yeah, you don't need a membership, and there's really no injury like on the short term, right, with running. I mean, if you go for 20 minutes, but long term, hips and knees and all that.
Man, I think running is brutal if you're not strong first. I always tell people you have to earn your running. If you're not strong, I saw a young woman running down my street the other day out front of my house, and she was probably an older teenager, and she was a bit overweight, and I could just see her joints just crashing and pounding as she ran down the street, and I just wanted to take her hand and be like, come with me to the squat rack.
Let's go.
I have it better. And that's the other thing. I looked around at the gym, look at all the people on the cardio machines, and then look at all the people over by the free weights. Who would you rather? This is not a disrespectful comment, but seriously, the people over by the free weights aren't spending a ton of time there, and they have the body composition that I know metabolically on labs is ideal, but it's also very aesthetically pleasing, versus kind of this run. A lot of those patients are coming in here with that abdominal obesity they can't get off, because when you constantly are elevating your cortisol like that, you're going into a pro-inflammatory state at all times, and they come in here frustrated saying, I'm doing CrossFit 3 days a week, I'm doing spin classes, I'm running. They're running crazy distances. They hurt everywhere, and they can't get rid of their bellies. And I'm like, this is just cortisol. They're increasing their inflammation across the board. by being in this chronic cardio state. Plus, studies have shown you have to run or do chronic cardio for like 50 minutes a day, 7 days a week, and the best you're looking at is maybe 2 to 3 pounds weight loss a month. Like, that's a lot of time and energy and metabolic output to lose 2 or 3 pounds. Best case scenario. And that benefit drops off pretty quickly after you start.
Getting acclimated to it, right?
Yep.
Right.
Yeah, and I just thought,
forget that.
Not an efficient use of my time.
Absolutely. Yeah, a couple things come to mind, Tina, but one study I wanted to bring up was about comparing cardio to weight training in a predictive diabetic onset, right? So if you only have 25 minutes a day, like what should you do? And so I was curious on this, and a study looked at that, and they showed that lower prevalence of heart disease and heart disease and cardiovascular disease and diabetes just doing weight training versus cardio. So there's some good data to show that weight training is actually superior, like you said, for people like yourself. You're busy, you're a mother, working and running a business.
Right.
So if you can do one or the other, I think the data clearly shows weight training is important. But a couple of things come up about weight training. There's some perceptions out there that weight training will cause leaky gut. I've heard this before.
Really?
Like, people ask me that, like, yeah, like if you weight train too hard and like overexert yourself, you're going to cause intestinal permeability. We do know in some studies like extreme physiologic stress will cause.
It elevates cortisol.
But yeah, I mean, free radicals go up after you work out.
Right.
But these are, like you said, hormetic beneficial changes. So but I wanted to tease this out because Hashimoto's is so prevalent, right? And multiple sclerosis, and a lot of people, a mental hurdle, again, just talking like mindset. They think, well, I have autoimmune disease, I have this, I shouldn't really weight train that hard because it's going to flare this or flare that. But here you're saying you've seen incredible shifts in yourself and clients. So anything you want to add? I
think that you have to guard your energy, and you have to guard your thyroid, and you have to guard your adrenals and your hormones. And so everything I do is for the benefit of my hormones. Every food I eat, every activity I do, I'm thinking in my head, what is this going to do for my hormones? And I start to notice if my testosterone goes up too high or this and that. Across the board, though, I think giving yourself micro doses of that hormetic effect makes you stronger, harder to kill, and I think that autoimmune disease tends to, it's the same, the studies just came out saying that the sun decreased thyroid antibodies. It was in rats, but, that is not just the ultraviolet rays. I think that's also a hormetic effect. So it's not been my experience at all, and I think that doing a chronic cardio or steady state cardiovascular type training all the time is going to really wreak havoc on your autoimmune conditions. I have 4 diagnosed autoimmune conditions, and my grandfather died a miserable death of MS, and I have had some glimmers of MS in my life, and I've never been officially tested. I don't want to know, to be honest, but I've had some pretty intense symptoms back in the day. And this is the one thing that completely keeps me out of that. If I start, one of the first things that happens to me is I start getting neurologic symptoms, which is not good for a practitioner. You don't want to have those at all. For me, it's my vision. That's one of the first things I'll notice. And when I strength train at least 3 days a week, that goes way down. If I'm running that cortisol pump all the time and that's what it feels like when you're doing cardio. You feel like you're just running on reserves that you don't really have. It's like borrowed energy. It's a very expensive way to exercise metabolically, I think, for many people. I do think some people are made to run, and that's great. And Ray McClanahan, and there's some other doctors out there that are avid runners, but even Ray will tell you he strength trains. He doesn't just run, so I think it's a balance. Other practitioners really love running. It's kind of in their genes, and they do well with it, and they keep their hormones balanced. But I think for some people, just hitting the weights, starting there, it's a very, it's a kind way to treat your body. It really is. And I think that you can, what are the studies on runners and leaky gut? Yeah, I think, well, like you said, it's mimicking that same stress response, right? It's that fight or flight response, Right, and you can overtrain anything. So I wonder what these bodybuilders, plus these are transient shifts of hormones we're seeing. So when those human growth hormone and testosterone levels go up, so does their cortisol. It's a transient shift, but it's like, how sustained is that? How long does that last? And is it detrimental? Or is it a hormetic effect? Who knows? Really There's not enough studies on it. Right. So we've talked about belly fat a little bit, and I think that's a focus of cardio is people think that if they do a lot of cardio, they're going to lose that belly fat. But like you said, it tends to actually increase, and I've experienced this myself when I went from weight training to a lot of competitive cycling. I had more belly fat than when I said, okay, this is silly, it's stressful, and I learned about functional medicine and stopped. But the thing about the glutes, though, I talked with Chris Miss Abbott about this. You see glutes all the time, right? Like when we're out in public, like if we're trying to be fit and like look the part and dress the part and so forth, like
people are looking at glutes, and so
Right.
they don't see your abs unless you're on the beach, which is a small percentage of your life probably, right?
Yeah.
And so I think people should really, let's talk about like the exercise for the glutes and how the glutes are really a major muscle group and what they do for our physiology.
Well, I want to add something before I do that. I started asking my most of my friends are guys. I'm a punk rock girl and all my friends are guys. And so I started doing a survey and I started asking them, okay, if you could pick a girl with a great set of glutes and a little bit of belly fat versus a girl with a six pack and a flat rear end, what would your preference be? And across the board, all of them said, nobody cares about a flat belly and abs. Guys don't care about that. They really don't. I mean, it's not as big of a deal as women make it. Everybody's so concerned about starving themselves down till their abs show that they completely forget the backside of their body, which is what's holding a lot of their spine together, you know?
Right.
And so that was really refreshing to hear. And as I get older, I really don't give a damn nearly as much as I used to. And so, plus those, I have seen patients, and I've had this experience, you get your abs, you get your beautiful six-pack as a woman, and your hormones completely dump out. Because that's our little depot. That's our little, I always think of Pulp Fiction when she was like, I want a little pooch, that one actress. That's where we keep our estrogen. And I've had patients get tummy tucks and come in a few months later losing their minds, and we test their hormones and they're gone. Because that was their little, our fat is where it's an endocrine organ, you know, and it can be advantageous or it can be negative. In a lot of patients it doesn't work so well, and it, you know, screws up their hormones. But anyway, I digress. So glutes. So your glutes, basically, if you want to look at it biomechanically, your spine comes down into your sacrum, and then you've got your two ilium, which are your hip bones, and that attaches to your lower extremities. All your forces crisscross and go up through that sacrum. That's sort of where all the action happens. There are no muscles that cross that sacroiliac joint, which is on the back side where your ilium meets your sacrum. The only thing holding you together really are your external hip rotators or your gluteal muscles. So I see a lot of patients with bad low back pain, sacroiliac pain, and then pain out here on the trochanters, which are the big hip bones. And they're very tender along the trochanters. So what happens when the muscles start to atrophy, which is what's happening to all of us because we sit all day long, and they start to get amnesia and atrophy, is they start to contract and constricture, and they start to pull off the bone. And where ligament and tendon meet bone, that's where all my work is, where my injections happen. It's called the enthesis. That area is highly innervated and very painful. So people come in with MRIs that look horrible. It looks like they have horrible disc degeneration and nerve root impingement. Their pain is nowhere near their lumbar discs or nerves. It's all where these muscles meet bone, and they're pulling away from the bone. So they're walking around in chronic pain, debilitating pain. I see it all day long, particularly in women, and it's because they have no butt. They have no gluteal muscle. So that's, if there's anything you can do, and if you focus, the one thing I learned through this journey, if you focus on gluteal strength, everything else besides maybe your shoulders gets worked. So your core gets worked, you end up with an awesome transverse abdominis, you know, firing pattern, you end up with abs. You don't have to sit there and do crunches and ab work all day. You just focus on training your glutes and your lower body, and like you said, keeping that leg strength strong so that your insulin levels are, you know, normalized. And people say, oh, I want to lose weight. I'm like, no, you want to gain strength.
That's huge, yeah, because
change your paradigm on that, you know.
Right. People forget where fat is burned, you know, and it's like it's really largely in skeletal muscle inside mitochondria. So the more muscle you have, the more naturally, like what you were just saying, the more fat you're going to burn. So yeah, it's funny that you say that. We haven't talked about this, but that's a huge thing that I talk about all the time, is focus on, you know, maintaining healthy muscle, like getting the fat out of your muscle, the insulin resistance and fatty marbled meat that a lot of people have through lifting weights. And so I want to finish off with weight strategies, but first, like, you know, you said you lift 3 days a week and do deadlifts and squats. We're going to finish off there, but let's talk about one last aspect of muscle. We can go on a muscle for probably days, but myokines and things that are secreted when we move muscle and brain-derived neurotrophic factor. What things come to mind you want folks to know about?
So myokines, so something, just a simple idea here. So cytokines are inflammatory molecules that our body naturally produces when we are trying to heal ourselves. I always think of things in terms of musculoskeletal medicine because that's all I do. But, you know, so you herniate your disc and you have pain, it's because, or you injure something, your body is building and secreting cytokines to heal the injury. We also secrete them when we have pro-inflammatory diets or lead a pro-inflammatory life. when your muscles secrete their own cytokines, and they're called myokines, and it's the same molecule. So interleukin 6 is a big one. That's a big, that's a big molecule in the inflammation and rheumatology world. When your muscles secrete interleukin 6, it's anti-inflammatory. So myokines are anti-inflammatory. So you can literally build an anti-inflammatory depot in your body, which blows me away. The minute I learned that, I remember thinking, this is it. Like, this is the secret, right? You can actually build a hormone-producing anti-inflammatory organ system. You can't make your liver bigger. Well, I guess you could drink it into being bigger, but this is a system you can actually control yourself by how you choose to live your life and the activities that you choose to engage in, and you can actually decrease your inflammation with that. So that's one. Like you said, it chews up insulin resistance like that, and it builds more mitochondria. You're actually producing more, right? I mean, from what I understand, you're making more mitochondria as you build that muscle tissue, and mitochondria is our little engines of, mitochondria blow me away. I mean, that's the secret to longevity, right? Is healthy mitochondria. So, and healthy oxidation and oxygenation. So having more mitochondria on board is always a good thing. I think that most chronic degenerative disease is due to mitochondrial death, or they're not working well, and you end up in this pro-oxidized state. So you're basically cooking from the inside. So building lean muscle mass will help with that. Chews up that, you build more insulin receptors, so you chew up all that excess insulin, which takes care of that. I think that's truly the only way to get rid of insulin resistance. I don't think there's any other way. I think we can give them herbs, we can give them pills, we can give them metformin, we can do some of these drugs have terrible side effects that you see on TV. Why not just go squat and deadlift? It's super efficient and it works. There's just no way around it. One of the things I enjoy about the work I do is I can get people back to lifting. And I see this with a lot of men who used to lift. They come in, their testosterone's low, they're in that metabolic syndrome state, they're kind of, belly fat, they're aromatizing their testosterone into estrogen, they don't feel well, and I'm like, you need to eat more healthy meat, eat more healthy fats, and go lift, and eat some dark chocolate and go lift heavy. And they look at me like I'm insane, because that's exactly the opposite of what they've been told by everybody else. But the ones who start doing it, when I get their joint pain down so that they can, it's like a whole new world. And the ones who listen are just, my tattoo artist, I saw him recently, and he had come to me for a shoulder injury years ago, and we were going to trade. We had talked about doing some trades, and he was working on my arm, and I said, are you still needing your shoulders worked on? He's like, no, you told me years ago to eat more protein and lift heavy, so I did. And he looks great. I mean, his waist came down, his shoulders came up. He was dealing with bilateral shoulder issues to the point where he didn't know if he was going to be able to, continue tattooing for much longer. And heavy lifting and some protein.
That's incredible.
But, metabolically speaking, I think that you fix everything. It secretes hormones.
Right.
So it secretes well-trained skeletal muscle, not brand new. I think that's the problem. All the studies are on people who they just get starting to lift. Rarely do they look at well-trained, or they'll take well-trained skeletal muscle patients and compare them to like onset cardio patients. Who these are not good studies. Anyway. Your well-trained skeletal muscle secretes its own testosterone and estrogen. It doesn't just boost your testosterone, it actually secretes it as an endocrine organ. So, again, my mind was blown when I saw that. I was like, this is it. This is it. This is the fountain of youth.
Right.
You secrete human growth hormone levels all day and night from it, which is, truly the ticket. You probably talk about that hormone on your other podcast, but that's the ticket to longevity.
Absolutely, that's huge. But you want to talk about detoxification. So what does the moving muscles and muscle tissue have to do with detox? I think that's important.
Well, well-trained skeletal muscle mass, not new, but well-trained skeletal mass acts as an organ of detoxification, much like your liver and kidneys do. So, and I don't know exactly the details of it, but that's what studies were showing, that it actually worked as an organ of detoxification in and of itself. So you can, again, create this depot of detox, and we live in such a toxic cesspool. Part of that's probably increasing mitochondria. Part of that's probably just increasing metabolism. But do you know more about specifics on?
I don't know. I was thinking about that, when you sent me that email about some things, I thought that was really interesting. I think moving the lymph, just the musculoskeletal movement, lymph flow. Everyone's talking about the gut now and how cool the microbiome is, and I think it's awesome, right? But we could easily talk about the lymphatic system and so forth. So lymph stagnation is a huge driver of inflammation. So
for sure.
Yeah.
And then just not to segue too far, but going back to the human growth hormone, that's how you heal up your endothelium of your gut. Right. You need adequate human growth hormone levels to heal your leaky gut. It will never heal. You can clear out the bugs and clear out the SIBO and throw all the herbs you want at them, but unless they actually can heal, and so my job as a regenerative injection therapist is to induce healing. That's what all my injections do, but I have to prime the patient to be in healing mode, and that's human growth hormone right there. So you can heal your gut a whole lot faster if you were actually to strength train while you're doing that, instead of just sitting around. And like, yoga is wonderful. I think running is wonderful. I think they all have their place, but I think that I look at them as activities that people enjoy doing. I look at strength training as like drinking water and breathing air and getting sunshine.
It's like a core element that we need.
It's a base, it's a base. It's one of the basic treatment guidelines in my head of optimal wellness is maintaining lean skeletal muscle mass. So just for all of those reasons.
Yeah, I was thinking about that the other day because I really feel amazing after yoga. I mean, because it connects you with your breath and mindset, and it really helps with meditation, but it's just not enough. I mean, it's a workout, but it's not the same. And so I'm glad you mentioned that, because there's a lot of yogis, and some of them, I mean, while they're really flexible and have great, mind-body awareness and mindfulness and so forth, don't have the best physique, right? And carry some like belly fat and things like that. So I was intrigued, and that's a point that I'm glad we're having this conversation, because people need to know that.
I see a lot of joint injuries in them. They're my other subset of income, besides CrossFitters, is hot yoga. That's because a lot of times they don't have the muscle mass to maintain those poses and those sustained stretches, and so they're just hanging on ligaments. And when you stretch out a ligament, much like a rubber band, it doesn't want to go back. So that's what I'm seeing. I'm seeing a lot of sacroiliac and shoulder issues in people who do a lot of yoga, because they don't have the muscle integrity to, kind of like running, they don't have the muscle integrity to do the activity as often as they are.
That's really interesting. Let's definitely finish off with some of the regenerative therapies, but I want to talk about your workout routine. I was intrigued by deadlifting 3 days a week. So I think this is a little individualized and personalized, and we talked about working with a trainer, but where do you suggest people, like the periodization and the types of exercise, what do you find that is good for folks?
Well, so for me, somebody who doesn't have, I have autoimmune disease, I've got several of them, and I don't have the hardiest hormonal system. So for me, it's all about, like I said, guarding my hormones and guarding my immune system. I don't want to rev it up too much, and I don't want to tank it out. So I have found for me what's easy, I got to get a lot of sleep. I've got to sleep probably at least 8 hours plus. I think the magic happens from strength training and the rest, right? You can strength train all day long, but we see a lot of these people, probably both of us, metabolically, they're in great shape, they look awesome, but their labs look horrible, and even though they're lifting a lot of weights, they're not resting. So I just wanted to throw that out there. Sleep is the holy grail on this. That said, I probably do 45 minutes tops. I warm up. I am much more respectful of the warm-up than I used to be, because I've hurt myself a few times now, so I keep throwing that out and going for the weights, and I end up back, 1 step forward, 2 steps back. Warm up for about 15 minutes, just get some great mobility in there, and then just turn everything on, get the glutes working, get the core working, get the back working, and then I go straight to deadlifts, because for me that's the most technical and where I can probably hurt myself the worst. And so I do my 5 sets of 5, and I build up. And some days they're lighter, and some days they're much heavier. I really think that trying to do a personal record is like a once a month thing for people like me who have autoimmune disease and hormonal disruption. I don't think it's a safe thing to be doing. I see it too often. People try to PR all the time, and they end up sick, or they end up burned out. So really just trying to, if you're going to go for big max weights, you have to respect your body. And so once a month, I try to really hit it hard. So I do my deadlift set, and then I will actually do 2 supersets. And a superset, for people watching, is where you do one activity, and then you maybe take 30 to 60 seconds to breathe, and then you start another activity. So you do a set of squats and a set of push-ups, wait a minute or a couple minutes, do a set of squats, a set of push-ups. And I think that pushing, just really primal movements, pushing, pulling, squatting, that's about it. So a superset, do my deadlifts. My superset will look like this. I'll do squats and push-ups. So I'll do my squats, I drop to the ground and do my push-ups. Do my squats, do my push-ups. wait a couple minutes, go on to the next superset, which will be a pull exercise, so some kind of pull up or lat pull down, and I'll do something one-legged. So I want to just make sure that I do like a unilateral and try to mix that up. So I'll do like a one-legged Romanian deadlift or a lunge or something like that. And then to end it, I will either fry out my glutes with like a hip thrust, or I will do farmer carries, because there's good studies showing that just picking heavy stuff up and walking as far as you can is really beneficial. So again, for me, it's just the hormones, like how much human growth hormone and testosterone can I get out of this session? So that's basically it. It takes me about 45 minutes to an hour if I'm focused, and your workout probably doesn't look terribly different, I'm wondering.
Pretty similar.
Yeah. It's just a really basic kind of, I've gotten it out of books and things, and that tends to work the best. It keeps my shoulders really strong. I had torn labrums in both my shoulders, and got lots of PRP and prolotherapy to them, and really it just came down to pull-ups and push-ups. It rehabbed me beautifully, better than anything I've ever done. So just getting strong, like if you can't, I really believe if you can't sprint away from danger and climb something to get away from it, or push something off of someone, like what good are you?
Yeah, right.
to be like helpful. I want to be helpful, if a bookcase falls on my mom, I need to be able to get it off of her, and I need to be able to carry something if I need to carry it, and I need to be able to climb up a tree and get away from danger. Really, I not like I think tigers are chasing me, but I just think maybe the zombie apocalypse is coming. I don't know. But it would be helpful to be strong.
Yeah, and that humans should have that natural strength, right? And they do in indigenous cultures, but not in present day. A lot don't, right?
And we're built for it.
Yeah.
We're built, so brain-derived neurotrophic factor, you mentioned that. So the study just came out saying that on rats, that cardio was better. They got a higher boost in that with cardio than they did strength training. But I'm wondering, how did they get the rats to strength train, for one? And I also, my background was in animal behaviorism. These are four-legged animals that scurry on the ground. I've had a lot of pet rats. I know how they work. But we are upright. Biomechanically, we are upright. We have huge lung capacity. Because we're upright and the way that we're built biomechanically, we are built on a system of hinges. So hip hinging, squatting, those are very natural, primal human patterns, and that you don't see a lot of other animals doing. We are meant to pick up heavy stuff, and we are meant to have lung capacity. So I do think that some cardio is beneficial, and we don't have to get into that. I like high intensity interval training. I don't like sustained cardio as much. It doesn't make me feel as good. But I don't know about that study. But you mentioned that you've seen others showing benefit from strength training.
Well, so I think that's the one potential upside of cardio, and so what I recommend, and I think just like 20 minutes first thing in the morning, just like on an incline, I like to read, and it really helps me kind of wake up and kind of prime the mind for meditation. But I'm not using it as like fat loss and all this. It's like, okay, this is really more of a mental exercise, because I'm weak in the morning. I don't do strength training in the morning. It's just my personal preference. Some people love it, like Jeff Lukoven we were talking about. He's up at like 4:30 in the morning strength training, right? So there's a book called Spark by John Mattei, I think at Harvard, and he's really big on cardio for like ADHD, depression, and then doing weight training later as well. So, and
I think part of it's blood flow. Just getting blood to the brain is very beneficial for people. So I think that's part of it. You're boosting the blood, you're boosting the nutrients throughout the body when you do some kind of cardiovascular disease. But I also work out in the afternoon. I feel really weak in the morning. I feel like I'm going to hurt something.
Right. Yeah. Just maybe it's an adrenal thing too, because I've burned the candle at both ends for a long time.
You've done your fair share of adrenal torch.
So it's better. So let's kind of finish off, Tina, with some of the regenerative therapies, and so give people an idea, because I know there's stem cells, there's PRP, there's Prolo.
Right.
What to use when for what injury?
Right. Well, I think it all starts with prolotherapy. I was trained as an old school prolotherapist, and prolotherapy, forget what's in the syringe, it's a technique. And it's a technique where, say you take a rotator cuff, for instance, ligaments and tendons where they meet bone, we talked about that, the anthesis point, that's where a lot of pain is for people. It's highly innervated. When that becomes injured, it starts to degenerate just like anything else. It loses oxygen, it loses nutrients, it starts to pull away from bone. It's very, very painful for people. So we actually go in there as prolotherapists and pepper those regions with the needle. So the needle itself counts. This is where, when you go see an orthopedic doctor who doesn't do prolotherapy for PRP, which I'll talk about in a second, it's not the same thing. Shooting PRP inside a joint is not the same thing as having your whole rotator cuff treated, where every ligament and tendon is tender, is where we want to inject. We want to stabilize down that joint structure. So does that make sense? So that's prolotherapy as a technique. Prolotherapy is traditionally done with dextrose, which is a sugar water solution, which causes the body to come in, mount an immune response, and say, hey, wake up. We want to, like, say your knee, for instance, we would want to put some inside the joint, and we would want to put some around all the supportive ligaments to say, hey, come in, do your thing. It's a modulated inflammatory response. It's not an out-of-control inflammatory response. We're just trying to get the immune system to come in, kick up some action, and strengthen up and tighten up those ligaments. And it's been shown to increase tendon strength by up to 40%. So dextrose itself works. Dextrose also sits on the TRPV1 receptor, which is very underappreciated. Basically, that's the receptor, that's the capsaicin receptor. It's responsible for a lot of neurogenic pain. So dextrose itself works as a local anesthetic. It works to regenerate by the immune response, and it sits on the TRPV1 receptor, which just calms the whole pain cycle down in that shoulder or that knee. PRP is platelet-rich plasma, and that is where we take out the patient's blood, we spin out the platelets, and they are known to have 20-some-odd growth factors in them. Some of them seem to be, as the studies are coming out, more important than others, but we concentrate it down to, I use like a 4 to 6 times concentration. I do that same technique, only I have PRP in my syringe. So it's not about just getting the juice in the joint, it's about actually hitting all the structures that are responsible. Because if you have an arthritic knee, chances are the structures that stabilize that knee are unstable.
Right.
And when you have an unstable joint, say in the back, you have an unstable joint structure, ligaments are meant to be stabilizers, muscles are meant to be movers. When you have chronic muscle tension somewhere, you probably have an underlying joint laxity issue. The ligaments aren't holding the structure together, so the muscles are now doing that job. So you get the muscles worked out all day, and it feels great, but then it comes right back. That's a ligamentous. That's an indication for like a prolotherapy type treatment.
Interesting.
So I reserve PRP for bigger areas like the low back, the Achilles, really bad rotator cuff tears. It kind of depends on the patient. It's only as good as your blood is. So we can look at studies all day, but that's, to me, apples to oranges, because your PRP is not my PRP.
Interesting.
You know, my PRP, a 25-year-old guy's PRP who's really well trained, who eats really clean, is not a 56-year-old metabolic syndrome postmenopausal woman's PRP. It's only as good as you are, you know?
Yeah.
And then, so that's like, you know, I always say tea, coffee, espresso. So tea would be our prolotherapy, PRP would be our coffee done in a prolotherapy technique, if I haven't confused everybody already. And then stem cells is like the granddaddy, if you've got really just, that's, I really don't use it that often. 2 to 3 rounds of PRP I think works very, very well, but I'll reserve the stem cells for people who really want it. Some people, I have a lot of people who fly in demanding stem cells because they think that that's far more important. I get the stem cells out of the fat. I harvest it from the belly. It's very high in mesenchymal stem cells. You've got millions of them in there, actually more in your belly fat than anywhere else. I concentrate those down, mix them with the PRP, and put that in the severely degenerated joint. But something you'll find super interesting, I'm pulling it out of their belly. When they are, I can tell, it's so weird now. I did all this metabolic testing for a decade, and now that I'm doing the stem cells for the past, I don't know, 3 years or so, when I take that cannula and pass it through the fat layers, people have very fibrous, if they've been inflamed or they have that kind of inflammatory metabolic syndrome belly, especially men, it's extremely fibrous and bloody.
Wow.
Which sounds gross, but I can feel my cannula breaking through the layers. It should just go through like butter. It should just be buttery, and it comes out looking very nice and buttery, and I'm sorry if that's gross, but it comes out at a very nice consistency. When people are inflamed or been leading a pro-inflammatory life, they've got all these little fibrous, and I think it's because the body's trying to wall off the inflammation, because your belly acts as a little inflammatory depot, right?
Right.
So of cytokines. So
Incredible.
when I break through those layers, I know immediately how the patient's response is going to be to the treatment, because I just pulled out their inflamed fat and I concentrated it down and shot it into their inflamed knee.
Right.
So
Wow, that's really interesting.
So if they come in with that belly, I usually encourage them to do something like a Whole30 diet. It's just something, you know, some kind of whole foods, paleo type, modified diet for at least a month to at least bring some inflammation down. And I, you know, give them curcumin and fish oil and that kind of thing. But it's compelling how their fat tells their story.
Yeah.
That's
really
interesting.
intriguing. Yeah, that whole adipose tissue remodeling and stuff like that, that really got me intrigued in fat, and like that it's more than just like a storage depot and stuff like that. So
It's a full-on endocrine organ.
yeah, it's really cool. So do you
Yeah.
see shifts, and if they do lose weight, you do the cannula, do you notice it's less fibrous and easier?
Well, I usually don't need to do 2 stem cell treatments, so I rarely go back into it. So, but if I do come in, you can just tell people are gristly.
Yeah.
I can tell. I'm so used to putting my hands on people now. I'm like, you're really gristly. You're super inflamed.
Yeah.
I know how much they drink. I know how much sugar they're eating just by the texture of their tissues. I can lay my ultrasound probe down on their joints and see. I'm like, oh, you have a sugar addiction.
Yeah.
And they
Wow.
go, how'd you know? Their bones will actually start to swirl. The bone spurs that come off of the lateral condyles will start to look swirly and overgrown versus somebody who's had a clean diet. I can tell by the looks of their cartilage under ultrasound what their diet has been like throughout their life.
Incredible.
Yeah, people who are well fed will have a nice, thick, smooth cartilage layer, even if they've been runners. Even I think that your joint health starts in your early years. I think we've seen studies. There's a study on moose they did on the Isle of Royale. They looked at moose over, I don't know, 50 some years. They looked at 4,000 moose remains. The moose that had been malnourished showed signs of degenerative arthritis exactly similar to humans in their hips and knees. And the moose that were well fed did not have that. And if you look this study up, the pictures are horrible. It shows an acetabulum, which is the hip joint, and within 2 to 3 years, severe just remodeling and osteoarthrosis happening to the joint structure just from malnourishment. So I think that people who come in here in their 60s with bad arthritis, they want to blame it on running.
Yeah.
I'm going to blame it on their diet
Right.
for the past 30 or 40, you know?
Oh my goodness. We'll have to put that study in the show notes, so if folks want to click the link below this video, they can learn more about that, which is interesting. So, Dr. Tyna, I love this interview. We have 3 final questions. They're kind of a little bit more informal, but if there was one herb, nutrient, botanical, or whole food that you just couldn't live without, like you mentioned curcumin, something like that, that you feel that has a lot of benefit for reducing inflammation, helping people live a long, healthy life, what would that be and why?
Fish oil. I love fish oil. I think it's really underrated. I know it gets a lot of press, but I don't think people realize what high doses of fish oil will do. It's amazing. More importantly, what it does for your brain, and not just the DHA. I think the EPA. I think that most problems with the brain are inflammation and microglial cell activation, and EPA just dampens that right down, which I think has tremendous downstream benefits on people's pain overall. So.
And you said high dose. What's that look like?
It kind of depends on the person and their absorption. So for somebody who doesn't have great absorption like myself, I take probably 6,000 to 10,000 milligrams a night. But some people can get it with 2 or 3.
Yeah.
But I never dosed fish oil high on myself or my patients until recently. And once you start getting higher, my colleague Alina Guggenheim is a naturopath who specializes in rheumatology, and she always says take a shot glass, fill it with half orange juice and half fish oil, and do 3 or 4 of those a day. If you've got really bad arthritic conditions, miracle.
Wow, that's incredible.
Miracle. It's absolutely miraculous. And I really think the EPA is the key there. So.
That's really awesome.
Yeah.
So what does your morning routine look like? We know that successful people, you have a big practice, you're a parent and stuff like that.
Yeah.
What does the first couple hours of your day look like?
I try to take at least 2 hours before I leave the house. I have a hard time getting up. I don't have a lot of adrenal stamina anymore. And so I try not to wake up. I know a lot of successful people. Doing the summit I just did, everybody gets up at 4:30. I was like, I'm not getting up that early.
Yeah.
I wake up about 6:30 or 7. I have 4 dogs, so they might get me up earlier. I try to relax a little bit with them. I really enjoy animals. I love animals probably more than humans, so it's really important to me just to spend a few minutes just sort of petting. I greet them all, and it calms me down. I think it makes me feel better. I start with my coffee. I like to do kind of a bulletproof type. I don't love eating in the morning, and so I really enjoy butter and I learned about butter coffee in naturopathic school years ago because they do that in Tibet, and a lot of my friends had come back from travels and brought that to school with us. So I love my butter coffee more than coconut oil probably. And then I just take my time getting out the door. I'll probably sit for about 10 minutes and meditate. It's hard with life and noise, but I try not to turn on the electronics, and I try not to get online. I try to just sit and sort of set my intention for the day, decide what I'm going to accomplish. I've really started taking to my lists. I love my lists, and so I love just consulting my lists and moving things across my lists of urgency and crossing them off. I like to write lists at night. I have a hard time letting my brain calm down, and I think a lot of people do. And I learned this from somebody a long time ago, probably a therapist, to write down your concerns. That way you can go to bed and let them go. Mm-hmm. So if your brain's a racer, if you're a racer at night, so I'll do that, and I'll look at them in the morning and think, oh, those aren't really a big deal. I can handle that. Right. So I like my lists, and then I get myself out the door. I don't start practicing until about 10. I actually get a lot of slack for that. Patients complain. But I'm sticking needles in them, and what I do is high risk and high liability, and I want to make sure I am on. Mm-hmm. So I actually stagger my procedures specifically so that I am safe and effective. I think about that a lot about like brain surgeons. How do they set their day so that they can do their surgery? Not that I'm doing brain surgery, but I'm putting needles in joints and spines. Anyway, get my 5 to 6 hours of patient care done, get home, eat something, and I like to work out at night. I like to work out. I'm a little bit of a vampire. Maybe 7 or 8 o'clock even, I think is my favorite. Late, yeah, I feel strong, I feel calm, I feel connected to what I'm doing, and I can focus, and the gym is in a zoo. Yeah. So I tend to really like that time of night, and then I come home, take a shower, smear magnesium gel all over me. Maybe magnesium might be a contender for the fish oil, but smear magnesium gel all over me and pass out. It puts me to sleep. It's the best feeling. So,
that's cool.
Yeah.
Right on. Do you ever do Epsom salt baths? I know that's another way to get magnesium in. What do you think on that?
I love it. I just I don't make the time for it anymore. I wish I did. It's probably a very good ritual. A nice place to meditate as well. Yeah. So, no, I love Epsom salt. I tell people to put so much Epsom salt in there that they almost sting. Yeah. I want them to sting and float.
It gets slippery. Your bathtub gets a little slippery.
It does. But I'm really liking the magnesium gel. I feel like you can get the doses higher than you can orally. So. I'll put them particularly over the areas I just worked at the gym so that I don't end up sore the next, hopefully. I'm hoping.
That's smart.
Yeah.
Awesome. So the last question here, if you were to bump shoulders with President Barack Obama or a future president or maybe someone from the World Health Organization and just had a little bit to bend their ear about a lifestyle tip or health tip, some nutrition related aspect that you feel that can improve the health of the world, what would that be and why?
I would tell them to get rid of artificial sweeteners. I think that they're neurotoxins, and I think that they are destroying people's brains and bodies, and I think that they're complete poison. I think they were manufactured, actually one of them was manufactured to be a poison, and it got turned into a sweetener. So yeah, I would get rid of artificial sweeteners. I would also tell them to squat every day.
There you go.
Every single day. Body weight squats. I don't care. I have a thing on Facebook. It's a body weight challenge. If you look me up, I don't profit from it. I just am trying to get people to squat every single day because I think that turns on your brain. I think it gets your body moving and gets your blood flowing, and it's a primal pattern. So
totally.
And it'll change your life if you squat every day for 30 days.
That's
so
awesome. It's a good challenge. So you mentioned Facebook. What about your website? If people want to reach out to you, Dr. Tyna, how can they do that?
So drtyna.com, they can find me there. It'll link up to my professional site and to my clinic. I'm on Instagram as Dr. Tyna. It's Tyna, so DRTYNA. I'm on Twitter there as well. So, and then they can find me on Facebook, Tyna Moore.
Awesome.
So
we'll have all those links on the show notes at highintensityhealth.com/drtyna. So keep up the great work. Thanks for coming on the show, and we'll talk with you soon.
Yeah, thank you.
My pleasure.